Healthcare is rapidly digitizing, but electronic health records, or EHRs, face serious risks. Data breaches and privacy concerns threaten patient trust, making secure, transparent solutions more important than ever. Traditional EHR systems are centralized, making them attractive targets for hackers. Patient data is often siloed, limiting information sharing and continuity of care. Patients have little control over who accesses their records, and tracking data changes is difficult, raising ethical concerns about privacy and autonomy. Blockchain technology, originally designed for cryptocurrencies, offers a decentralized, immutable, and cryptographically secure way to manage EHRs. By distributing data across a network, blockchain reduces single points of failure. Every access or change is timestamped and logged, creating a transparent audit trail. Smart contracts can automate consent, letting patients control who sees their data in real time. Projects like MedRec from the Massachusetts Institute of Technology and Estonia's National eHealth System are pioneering blockchain-secured health records. Patientory empowers individuals to manage and share their health data securely, while GuardTime verifies data integrity for Estonia's health system. Scalability, privacy, usability, and legal frameworks remain challenges. However, blockchain could enable global, interoperable health data ecosystems and AI-driven analytics, transforming healthcare data management. Blockchain promises a future where patients truly control and trust their health data.